All right, so we're going to take a look at conditions for both the thyroid and parathyroid. So this is the first one here. It's called creatinism. Creatinism is a condition where you have hyposecretion of both T3 and T4. And this really happens specifically during fetal life as well as early on in kind of infants. If that happens, you end up with two conditions. You end up with specifically dwarfism, so they tend not to be as tall as they should, and they also end up usually having some sort of mental retardation or some sort of mental disability. You can test newborns, and if we find out that they have this kind of hyposecretion of T3 and T4, we can give them artificially T3 and T4, and that can subside some of the symptoms, if not even prevent them from even happening. They can even do a screening pretty quickly in utero, so they can do a before the baby is born to do the same thing. Treatment, though, would still have to wait till after the baby is born for that process to take place. This is usually what you end up with, kind of these kind of kids. They tend to have kind of this um, protruding tongue, kind of rounded face, and they tend to just be a lot shorter than they really should be because of the effects to their metabolism. All right. Another one you can have then is if it happens in adulthood. So now we have hyposecretion of the thyroid hormones in adulthood. You get what's called myxedema. Myxedema is simply just when you have this hyposecretion of the thyroid, you get this edema pretty much all over underneath the skin. So they have this kind of roundish face, very puffy, kind of looks like they're just swollen all the time. They have a really slow heart rate, again, because they're hyposecreting those metabolism hormones. Body temperature is decreased. They have a drying of hair, again, because they're not producing a lot of oils of both hair and skin. They have muscular weakness, lethargy. They usually gain weight, again, mostly because of this edema. Treatment, again, is to give them some sort of oral thyroid hormone to reduce simply just the symptoms. Okay. Other things you can see in this process with myxedema, they usually will have an enlarged thyroid. So they'll have what we call a goiter. They usually don't have much of an appetite because, again, their metabolism isn't kind of revved up like it should be because of the hormones, but they do still gain weight because, again, of that edema. Right. Next condition that we have is a goiter itself. So a goiter is just the enlargement of the thyroid. This is usually caused because of a deficiency in iodine. Iodine is one of those things that our thyroid actually needs to be really healthy. And if we don't get that iodine in our body, then we tend to have issues with it. People that tend to have issues in deficiency of iodine tend not to eat enough fish, eggs, vegetables, or kind of leafy greens, or if we start to see that to become a problem, we can actually have these people take some sort of an iodine supplement. And what happens here is the thyroid kind of doesn't become functional, so it doesn't start producing it, it just starts to enlarge. So the body, this thyroid stimulating hormone, keeps calling for more of those thyroids, and it just keeps making the thyroid get larger and larger. Okay, because it's an overstimulation because of the thyroid stimulating hormone coming from the pituitary gland. Other things that can cause goiters or enlargement of the thyroid gland can also be tumors and exposure to like radiation. Radiation, because the thyroid is pretty active, will go after that. So a lot of times people that are exposed to radiation are actually given iodine iodine pills to kind of help supplement that and kind of protect their thyroid. Okay. Another one that we can get from the T4 and T3 this time is hypersecretion. So if we have a hypersecretion with the body not really telling it to stop, we can get an enlargement of the thyroid again. So we get this goiter. We get a bulging of the eyes. All right. So the eyes look like they start to bulge out of their sockets because of this. And then they have this increase in metabolism. So because of the increase in metabolism, they have heat intolerances because their body temperature usually is elevated. They usually have an increase in sweating, again, because body temperature is elevated, and then they have a loss of weight, even though they're probably eating what they normally would be eating. They tend to have problems sleeping, so insomnia, because, again, their metabolism is kind of racing all the time, and they're kind of pretty nervous and have tremors besides. So treatment for this one, we can usually do some sort of surgical removal of part of the thyroid that will tend to kind of slow this process down. We can do a radiooctopsy, which will actually destroy some of the thyroid tissue. Or there are some anti-thyroid drugs that you can actually give these individuals to help suppress and block the hormones from being produced. All right. The last one then is parathyroid hormone. So since the parathyroid hormone has more to do with calcium levels, we tend to see some issues here with calcium levels. When we have issues with calcium levels. So the blood calcium levels fall too low, we can actually get overactivation of neurons. All right, calcium is needed to kind of help with those impulses back and forth between the brain and the body. And if that calcium isn't there enough, that we can actually get an overproduction of those stimuluses. The neurons themselves can actually cause the muscles to contract and causing what we call tetany. So this is a full-on muscle contraction that doesn't let go, or what we usually refer to as a spasm. You guys have probably gotten like cramps in your calves and things like that. These would be because of really no activity, and usually they do not subside. The most lethal part of this one is that you can actually get a spasm of the heart muscle, and then obviously that could cause death. Okay. All right. So make sure you know your conditions here with the thyroid and parathyroid hormones, and just kind of note a couple of the basic signs and symptoms of each one of them. Most likely on the assessment, you're going to see questions that are just going to be multiple choice, asking you to kind of pick back and forth between the two. Okay.